Well, welcome back to another episode of Empowered by Victorious. Again, my name is Stacy, and today I have the pleasure of having a conversation with Jami Wilson. She is a physical therapist and co-founder of Empower Physical Therapy here in Lincoln, Nebraska, specializing in pelvic floor specific physical therapy. So I'm super excited to have a conversation with her, not only just from a professional standpoint, but from a personal standpoint. She has a wealth of knowledge from her own life experiences. And I know she's a mom and has been through a lot of different navigating on her own and professionally, obviously, is helping women do the same. So thank you, Jami, first and foremost, for being here and taking time out of your day. I know time is a valuable thing.
Thank you for having me. I'm excited about the opportunity to talk with you today. So thank you.
Yeah, yes, of course. Well, Jami, what led you into like physical therapy? Because I think, physical therapy is its own beast, right? Like you can go and be a physical therapist, but then there's like different aspects of physical therapy that you can really like specialize and start to get into, as it is with a lot of different professionals. So number one, like what led you into physical therapy, and then what led you down the path of specifically like specializing in pelvic floor?
Yeah. I actually knew at a very early age, I would say for most people, that I knew I wanted to at least be in healthcare in a sense. I would probably say as early as seventh grade. Like I was always an athlete growing up. I think that's how a lot of physical therapists start, is just having that background of movement, athletics, your own injuries along the way. Um, and I was in a pretty competitive soccer team growing up, and one of my teammates' moms was a physical therapist, and she would like bring along like her modalities, her ultrasound machine, and be taping our ankles and doing like that type of stuff at a young age for us. And so I think I was introduced to it there. I always loved just like science, the body. So I knew healthcare, like definitely it's like, do I want to go physician assistant route? Do I want to go this route? But ultimately, what I love about physical therapy and being a physical therapist is you get to see your patients through the whole journey. It's
Mhm.
not just like one appointment every year or every 6 months. It's like you get to know this person. You become like a really pretty integral part of their life during this journey to help them back to whatever goals they want. And so I really like people. I like working with people. And so that's ultimately why I probably picked like physical therapy, is just that patient interaction and really being like handing, standing alongside them through that journey. So then I went to UNMC for PT school in Omaha. Definitely just kind of a broad based physical therapy background. You can come out as whatever physical therapist you want. I went the orthopedic route, but during one of my final clinical rotations in physical therapy school, one of my clinical instructors was doing what we called at the time women's health. And we had learned like, we did maybe like a 2-3 hour class in school. Like it was minimal. Like, so,
Mhm.
you look back and it's like sad that like how little, and it was like Kegel weights is what I remember from it, which is like, I don't even do Kegel weights, and so it's just, it's so funny. Like that's what I remember from it and how like different the field is now. But one of my clinical instructors, I got to follow her, and she also did orthopedics. So I got a little mix of everything. I was just like, this is incredible. Like
Mhm.
you're helping people, like who are scared to leave the house because of their urinary urgency frequency and like don't want to travel. And all of a sudden they're like coming back and being like, I, you know, I was able to hold my bladder for 2 to 3 hours. I feel like I booked a trip. Like it's truly life changing. And it was
Mhm.
so rewarding. So I got exposed then, knew at some point I'd want to go pelvic health, but you get out of school, I'm 25, my patients are 50, 60, and they're looking at me and I'm kind of like, oh God, like I know I'm an expert at what I'm doing, but I still feel like I have a lot to learn. And so I kind of put that on the back burner, just really got my orthopedic skills, got more confident with those, got more confident in myself. And a little ways in, so it'd probably be about 6 years ago is when I was like, I need to dive into, more just specific pelvic floor work and assessment and treatment. Definitely felt like I was missing things with some of my patients. I was referring my patients out to pelvic floor therapists, and I'm like, I want to be doing this. I want to know what I'm missing. What's this missing piece of the puzzle? So that's when I got into pelvic health. And then after that, I ended up having my own, pregnancy, own child. And that really just kind of catapulted me a little bit more, being like, I actually felt like I knew something, yet I still felt very underprepared and did not, there was a lot changing with my body. And for someone who was very aware of my body, I felt a little bit like, wow, this was a lot. And I just don't want women navigating this on their own. So that's, started pelvic floor, worked that for a while. And then COVID hit. And I think everyone has a COVID baby in some sorts. Mine was a business. And I think everyone reevaluated life a little bit during that time. And I got together with my business partner, Stephanie Erbaum. Actually, she was kind of like a mentor to me. She has been doing pelvic health a little bit longer than me. And so I actually got together with her to go over a case study. And she looked at me and she's like, when are we opening our own clinic? And I'm like, oh, like, okay. I come from an entrepreneurial family. I thought I always knew at some point I'd probably own my own clinic as well. Seems scary to make that jump though. Stephanie was just though like, we need to do this. And I was like, I'm ready for a change. I'm ready to kind of redirect my life a little bit, and literally just got the ball rolling so fast that I didn't have a chance to say no, and because I think if I truly was like, Jami, you know nothing about business, like if I actually thought about it, I should have been like, maybe you should learn a little more. But I was like, I know people, we'll figure this out. And so that's where Empower Physical Therapy came. I would say we probably got together like October of 2020, and we were building out our space in February 2021, opening April 1. It just happened quickly, and I'm glad it did. And there was it's been awesome, and it's been so great to be able to be here and serve Lincoln, and it's been a lot of fun as well.
And needed.
I'm learning a little bit of business along the way. So
yeah, that too.
Yeah.
No, and so needed, right? Like that. Yeah. It's just such a, when I started doing this, and, same for you guys, like when you guys are first opening, but when I was, first coaching clients and talking about pelvic floor back in, 2007, 18, 2019, it just was barely starting, to start to be something that people were starting to talk about it and starting to seek it out or seek out help within the, pelvic floor therapy. And I think there was different levels. I think pelvic floor therapy looked a lot different in the hands of providers, I think back then versus what it's evolved to now. Bethany and I have had that conversation. Steph and I have had that conversation, just that consistent, okay, this is kind of where it was, but that was just, you can't just know one thing, the pelvic floor is connected to the core is connected to the pelvic floor. There's so many different aspects of just a pelvic floor screening or pelvic floor evaluation. So it is something that I think is catching on and is, getting very common, not necessarily, just normal in regards to seeing a pelvic floor therapist at any stage of life. But specifically, I think postpartum is probably where it's getting the most speed. We're getting a little bit more velocity in that regard. Obviously, there's a whole wide gamut of people that probably could benefit from pelvic floor therapy, including probably everybody on that spectrum, especially if you're factoring the core piece. But yeah, I mean, it's just such a needed thing for women in any stage of life and at any point. And I say for women, but I mean, my own, I don't think he would care. My father goes to a pelvic floor therapist. He's been seeing a pelvic floor therapist for, I don't even know, probably 3 years or so. Just yeah, I'm not going to go into the details, but I mean, it's not just a woman thing, necessarily, right?
Yeah, you know, and that's what I kind of, as I said, like back in 20, it would have been 2012, when I was in that clinical rotation, really was called women's health, like
Right.
women's health. But we know, and they have now we call it pelvic health, pelvic floor therapy. Everyone has a pelvic floor, everyone, male,
Right.
female, and dysfunction can happen at any point of your life. You know, it can
Right.
happen in pediatrics up to geriatrics. You don't have to have been pregnant or have a baby to have, you know, issues with your pelvic floor. And I just really, I don't think people understand that. They just, you know, and
Hmm.
like you
No.
said, I do think social media and just people are more open to talk, which I can
Hmm.
appreciate. And that's really driving people to have these conversations and know that people like physical pelvic floor therapists exist and can help you with issues that you're
Right.
maybe nervous to talk about. And so
Hmm.
the change from when I just started pelvic health even to now is so different. We have the phone calls of women who are 10 weeks pregnant and are like, I have zero symptoms right now. I just
Hmm.
want to have a healthy pregnancy. I want my to like have a good pelvic floor and core and prepare for labor. And I'm just like, this is the coolest conversation. Like,
Yeah.
this is so much fun that people are being proactive and preventative
Hmm.
on something. And you can't prevent everything, but like, you know, just being on top of it and being an advocate for themselves. And it's been, that's where it's really fun. Like, we're not, and trust me, I still see the people who've had, you know, urinary issues for 35 years and they're like, I wish I would have come sooner. And I'm like, I do too, but we didn't know. You didn't know,
Hmm.
you know? So, and it's never too late either. That's another thing I
Right.
like to tell people is, um, you know, postpartum is for life. You know, yes, there are
Right.
stages that are a little more vulnerable in those postpartum stages, but your body has made change. Your body has changed hormonally as menopause hits. So much is changing, and so come, you know, see a pelvic floor therapist, even if you've been leaking a little bit for all your life. Like we can help you. You know, so
Yeah. Yeah.
um,
It's not too late.
it's
It's
not
not
too
a
late,
too late
and
thing.
it's. So yeah, I'm
Yeah.
passionate about, you know, just I think everyone should see a pelvic, you know, floor therapist at some point. But yeah, men,
There's a spectrum that I
yes,
think
yes,
awareness is just like continuing to increase for
yes,
sure.
and it's really fun to see. And then you have gyms that are focusing on this, which is, I mean, it's just like who knew this would happen, and it's really exciting to see the changes, and I'm excited to be a part of that, the growth.
Yeah, well,
Yeah.
and I think that that's that collaboration of, you know, I know professionals struggle with referring to gyms because it's, you know, how do I know that my people are going to be safe? How do I know that they're going to be able to like do what they need to be doing? Or they get patients from gyms where it's like, oh, you've been doing that wrong, like for the last however long, and now I need to fix it. So, you know, some gyms and even us probably at points get labeled like, oh, like, you know, maybe they don't know what they're doing, or you know, they're doing that wrong, or they're teaching that wrong. And it's hard in a group setting, like you're going to get a wide spectrum of like what you can control and what you can't control, within those different spaces. So being able to refer, being able to really train our coaches on like, what are we spotting? We're not going to try to fix it, but we're going to try to at least minimize the effects, you know, and minimize the symptom within the movement, and then refer any and every time that we have or see an issue that is outside of our scope of practice. You know, when people ask about pelvic floor dysfunction in the gym space, it's always like, well, I can't see what's going on inside of
Mhm.
you. Like
Mhm.
and nor do you probably want me to be honest. So, you know, what you're describing to
Fingers on the
me.
floor.
Right, right. Or
Some
like,
people want
yeah, I mean, I've had an internal exam.
yeah.
I'm good. Like, I don't want to do that for someone else. I'll dabble into birth doula, but that's about as
There
far
you
as
go.
I'll go
Yes.
on that. Um, but yeah, like it's just there's so much going on inside of your body and firing in different ways, and like or not firing in other ways, or under tension or too tight or not moving. Like there's just so many different things. Your hip positioning could be off, and I can't, fitness professionals can't necessarily see that. We can see your movement pattern, but we're not trained in like seeing, those types of anomalies within that actual like, anatomy and structure internally with the pelvis. So it's, our job to really advocate for that referral process and advocate for them to advocate for themselves to go and like get help deeper than what we can do. And then hopefully once they get that help, they can bring it back and be like, okay, like this is what works for me for now. This is what we're going to do. And that's super awesome. And I mean, I'm a little biased now, but I mean, having Jen that's working with you guys, like as a coach within our space has just been like absolutely incredible. With her, she just like, from a wealth of knowledge to advocacy for pelvic floor therapy, from everything else, it's unique. And like, I think it's a super cool opportunity for, obviously the women of Lincoln in that regard, but also women at large should have these resources and like know what to look for. So when you're, working within, let's say, obviously like the people that we see are going to be in the gym, right? Like they've come in, they either went through their onboarding, they're saying, I don't have any pelvic floor dysfunction. Like I don't pee my pants. That's usually like one of the first things that we'll say, like, do you have any of these types of symptoms? And they're like, well, no, I don't pee my pants. Okay, well, that could be one symptom, but there could be a lot of other symptoms, right? And so what are the things that you, like big red flags that maybe somebody within a gym space in that initial evaluation that you would hear where you would be like, yeah, maybe that's something that we need to get checked out? Because a lot of these women are coming in, they've never really lifted before. This is their first time actually like really lifting. And so we want to be aware of what's going on internally, because if it hasn't reared its ugly head yet, it might start to now that we start to put on some load.
Yeah. And that's, yeah, like gym space group fitness can be hard, and are people being forthcoming about everything going on,
right.
And that's definitely a challenge. But I definitely are you feeling any pelvic floor heaviness or pressure?
Right.
Like that's always kind of something to us, like maybe there's some prolapse going on, which again doesn't mean you can't lift, but it's just making sure we have good mechanics. And then is there any like urinary or fecal leakage or like loss of control of like gas while you're lifting? Like you don't feel like you can control that. I would just say pain in general, which doesn't necessarily mean your pelvic floor, but like back pain, hip pain, tailbone pain, definitely, if you have real pelvic pain, but could be associated with pelvic floor. So I always just think paying attention, like we shouldn't be hurting when we're lifting, right? Like we should be feeling better after we move. Yeah, maybe some muscle soreness, but not in pain. And so those are typically the things I'm looking at the most. Because the other side of it is like some people get so scared to move because they're so, and it's like, I get diastasis recti is a big thing. It's like, and people are like, I'm so scared I'm going to just worsen this, that like I'm like paralyzed because someone's telling me this, someone's telling me that. And if you're on the internet, it's all over the world, and what the solutions are. And I'm like, let's just move. Sometimes it's just like, let's get moving. Let's maybe start slow. Maybe like we don't need to go crazy heavy at first. And see how our body feels. Let's work into it. Let's try some different breathing strategies. I really never try to tell someone like you need to stop something, like let's find a way to make this work, especially if that's their outlet. That's how they like to move their body. And so, definitely some red flags, but it's never something where I'm like, oh my God, like just have to completely stop. Like,
well, yeah. And that's something with the screening process that we go through, because it's hard, because it's like, okay, low back pain could be a lot of different things. Like, there's a whole gamut of things at low back pain. So we're usually like looking for low back pain and like any of these other points, right? And then like trying to refer from that space versus like Well, low back pain is kind of like, could be a universal, like you sit too much, or you could, literally like a
Yes,
lot of different things.
so many things.
Core
Yes.
dysfunction, a lot, which could be
Hmm.
pelvic floor too. So,
It's all connected.
um,
The body's connected, and
right.
so that's what I personally like about being a pelvic floor therapist is we're still going to look at you from head to toe. We're still going to look
Right.
at how your spine's moving, how your hips moving. I'm going to look down to your feet, like what's going on at a foot level, because that's going to affect hip rotation, which affects the pelvis. So it's really, it's it's a journey of
Mm-hmm.
looking at someone's body, and having someone take a look at that, and then also doing, like you said, that internal part, which
Mm-hmm.
you're not seeing at a gym. So
Mm-hmm.
whether that's, I know that here at Empower, we do a lot of internal work, as long as the patient's okay with it, of course, and with
Mm-hmm. Oh
consent.
yeah.
But we feel like that is the piece of the puzzle that gets missed a lot. And are we managing pressure correctly? Are we
Mm-hmm.
coordinating these muscles correctly? Um, what are those muscles doing with breath? What are they doing under load? Well, we're known to do standing assessments with an internal, a finger
Mm-hmm.
internally to know you look different laying on your back than you do
Mm-hmm.
standing up, and maybe even under a load. I've had people with dumbbells in their hands while I'm doing an internal standing assessment, because if that's when you're symptomatic, I want to assess you when you're symptomatic. And so then it really puts all those pieces together, where it doesn't mean like we can't do this exercise, but let's maybe modify it this way. And
Yeah.
um, it never hurts to go see one. That's the other thing, like it's not like a medication or something we're putting you on. It's like just an awareness and assessment, and how can we, or
Oh, you're good. Yeah. Yeah. Like
issue.
it's an awareness thing.
Yes,
Yep.
yes. So
No, for sure. I think the big things, like I said, like the internal piece that you mentioned and positioning is being so big. Maybe speak a little bit to like, I think a lot of women, if they're not being referred to a pelvic floor therapist through a gym, usually it's potentially through their OB, right? Like those are probably like the two places where we could see, or their midwife, where they're seeing that process take place of like that referral source. But I have known a lot of women that, either postpartum or, they're, approaching perimenopause and they go to their OB because they're feeling heaviness or they're feeling, just some pressure, or like I describe it like almost like it feels like your tampon's falling out. Like it just kind of like feels weird down there, right? And OB puts them on their back, they do an exam, and they're like, no, everything looks fine, like, and send them on their way, And so I think it's a advocacy of like understanding, not saying that OBs don't know what they're talking about, don't know what a vagina looks like, don't know what a pelvic floor looks like. They do, but there's also like a level of expertise of what you guys do in a different way, in a different skill set and different training that goes so much deeper than that. And like you're aware that positioning matters in regards to like how it looks on laying on your back versus once you're standing up, right?
mhm.
And having women advocate for themselves in those situations, or maybe it's just not going to your doctor, and it is, but you can go to some place like you and
Mhm.
start there, right?
Yeah, yeah. Pelvic organ prolapse is a scary word. Like
Yeah.
it's can people just get like, oh my God, like my doctor told me I have one. Um, and it can feel very scary. But I would I don't know the statistics, but I would imagine that a woman who has been pregnant and delivered vaginally has some degree of prolapse. Like
Hmm.
it's just like, but that doesn't mean she's walking around feeling any prolapse symptoms. Doesn't even probably know she has a prolapse. So
Hmm.
there is just you think of these pelvic organs that are being like supported from the bottom, but being held at the top by a fascial ligamentous system. Like over time, just with gravity, things start to kind of like settle. And then
Right.
we throw a pregnancy in there, and then we throw the weight of a baby, and then we throw a bearing down, pushing out a baby, and just constipation, chronic constipation, all these things, all these factors are just kind of weighing down. And I see all the time, people come in, maybe have looked at their vagina for the first time postpartum. And I'm like, maybe, 5 days postpartum isn't the best time to look at your vagina for the first time, but they do a lot. And they're like, Jami, oh my God, I see there's a bulge, like there's something there. I see something, it is. And I'm like, okay, let's just take a couple deep breaths. Like we're going to be okay. Like prolapse is really not prolapse until, if it's coming out of your body, yes, there's different stages, but unless you're symptomatic, like, are you feeling heaviness, pressure? Are you not? And a lot of times that can be driven hormonally if we're like in a de-estrogenized point of our life. So if we're breastfeeding, I find that those patients are a lot more symptomatic as you're going through perimenopause, menopause. And so then collaborating with, your OB, your midwife, your nurse practitioner, whoever you're seeing, to like, can we get something on board to help like just during the phases of life, so that, because all of a sudden, like I'll have women who are no longer breastfeeding, their prolapse looks the exact same, but they are no longer symptomatic, Also, we've worked on breathing strategies. We've worked on positioning. We've worked on managing intra-abdominal pressure, normalizing bowel movements. It's not just one thing. It's really looking at it from a variety of factors, but knowing that or we use pessaries. I don't if everyone has heard of like a pessary, which is a space occupying device. But they make over-the-counter options of those. So can we be using something like that while you're a little symptomatic? I find people are more symptomatic when they're in stressful periods of their life, maybe through different phases of their menstrual cycle. But it's something that we can live with. And it seems very dire when you get that diagnosis. But as someone who has had, have a cystocele, which is a little bit of a bladder prolapse, I'm symptom free. There are days where I'm like, okay, yeah, I really overdid it. Like I went a little heavier with stuff and I feel it, but I know how to then manage. And that's really the tools we want to give our patients is, are you going to be perfect all the time? Probably not. And will there be days that you have symptoms? Probably. But what can you do to help your body and find that relief? And we're here to help you, but we also want to give you those tools of how to manage on your own and it not be so scary and still do the things you want to day in and day out.
Yeah. And I think going to your point of that, 10-week pregnant woman that is seeking you out and wanting to be preventative in quotations, right? Yeah. I think that that's so unique, but also not, because I think there's going to be a lot of people okay, well, how do I prevent this? How do I avoid this? How do I stay away from this? Or I had a C-section, so, this probably isn't going to apply to me, which we know is probably false. But within the preventative side of things, I think I have some theories in regards to the way that we're giving birth, and the positioning that we're giving birth in, that maybe could help I'm not saying that it would solve all of pelvic floor issues ever, not saying that in any way, but birth positioning, the position that we've been pushing in, I could argue could probably add to some issues pelvic floor wise postpartum, right?
There's research out there that supports
that
statement. So for sure, Stephanie and I actually earlier this year had a really cool opportunity to talk to some of the labor and delivery nurses, some of them, not all of them, some of the labor and delivery nurses and the mom and baby nurses at Bryan on bridging the gap of pelvic floor and what we can do to try to prevent some of the injuries that happen. Again, pregnancy, labor, delivery, we can prepare for it, but we can't predict, there's a lot of unpredictable factors in there. And so it's good for us to kind of know what all can happen. But, we love here at Empower working with women, even just the prep for labor. That's something that with my first, I was already in pelvic health, but I didn't realize that was a lane that we could be in, that we could help with that. I learned that later and I'm like, this is super cool. But learning different positioning and kind of what I call you don't want like a fixed sacrum, so the sacrum's at the lowest part of your spine. Like you want it to be able to be movable. So for it to be movable, like, can we be on our side? Can we be on all fours? Can we be in different positions other than on our back? Unfortunately, there is hospital policy and things that just are different providers, personalities that like, it's harder to get around. So I'll even like tell people, let's roll up 2 towel rolls and put them on either side of your sacrum, like right down the middle of your butt on both sides, if they're going to have you on your back. So at least we can get that like sacrum and that tailbone room to move, so kind of like being creative and finding ways to like get around what
policies
are, and they're there, like, but I think giving people that information and that knowledge allows them to then ask more questions, which I think is huge. I think, breathing, we've talked a ton about open versus closed glottis pushing. And that like, yes, closed glottis pushing is what's being taught most of the time, which is that like hold your breath, bear down for 10 seconds and push as hard as you can. And it's effective. I'll tell you that,
absolutely
it's gonna work. But are we in there's no like prize for pushing your baby out the fastest, let's allow that baby
it makes
time
the pain go away faster.
It does. Well, I had an epidural, so, but,
speaking from experience and the broken blood vessels in my face, I was like, just get it out.
Get it out. Well, for sure. Every situation's different. We just want to give tools, but, sometimes the slower descent down allows that perineal tissue time to soften, to relax, so that we maybe don't have as much tearing. If we're not bearing down, holding our breath, maybe we're not putting as much pressure on pelvic floor, decreasing maybe risk of pelvic organ prolapse. There's lots of things, but like you said, everyone is in a different situation when they birth. Are we we need to get baby out fast? Is there unmedicated, no epidural? Maybe you're just like, you have the fetal ejection reflex. There's so much going on. But at least knowing some of this before going in, when you're in the trenches of this, I just think, some options. Like, I don't have to hold my breath. If I want to breathe out while I'm pushing, I can. If I want to kind of roll onto my side, that should be okay. If I, I had something else in my brain and I'm not thinking about it right now. But, there's options, how to relax and lengthen your pelvic floor, where to direct your pressure. That's what I want to say, like the broken blood vessels in your face. Like as you're bearing it, where's that pressure going? We don't want it to go to your eyeballs. We want that pressure to go down towards that pelvic floor. Allow that relaxation, lengthening of your pelvic floor, because your uterus should push your baby out. We want pelvic floor to get out of the way. And so just learning how to even direct that pressure, because I find all the time people don't know how to coordinate that. And so learning that before can be super powerful. I think as people don't think about prepping that way, I think we do a lot of prep during pregnancy, and we do a lot of prep for postpartum, and like maybe if you want to breastfeed, preparing for that. But like that little window of labor and delivery, I don't think we think about very much. But what happens there can really change your postpartum recovery. So I think it's a space that's not, being looked at as much as I would love for everyone to want to care as much about as I do.
No, I think we're hitting on some magic right here, because I do think it is definitely something that, like you said, like we prep, exercise in your pregnancy or, get prepared postpartum. I think that like maybe slowing down postpartum is starting to catch on from like a rehabilitative standpoint. Go see a pelvic floor therapist. Postpartum is definitely catching on, but like not realizing from a preventative standpoint, not that you are going to prevent everything. That is impossible, right? Like birth is an injury, whether you like it or not, whether it's a C-section, whether it's a vaginal delivery, like whatever it is an injured state. Like your body has been through a traumatic, not saying negative always, but a trauma response. And it needs time to heal, but there are things that you can do in that labor and delivery process preemptively and in that moment that can have ramifications for the rest of your life, potentially, And that's okay to like talk about. And finding a team and educating yourself by seeing somebody like yourself, as a professional in the pelvic floor space, but also like finding a team of doctors or nurses or a space where you can deliver in a way that you feel like you can advocate for those changes that you want for yourself, right? Like you have to hire the team around you to support the goals that you believe in and desire for yourself. And that's a huge component of it. And it's hard. We live in Lincoln, Nebraska. Like birth in Nebraska isn't exactly.
Yeah.
Yeah. I think in other parts of the country, this isn't necessarily like something that we have to like kind of tiptoe around in a way,
Yeah.
Yeah.
Yes.
You're like, yeah, it's like a thing. No, it is. I mean, again, like I
Yeah.
get it. Like I'll use a story for example. Like I had a doula client who ended up hiring me at 37 or 33 weeks. She had planned her normal doctor, all the things, epidural, medicated, just wanted to bounce back postpartum, all the things, and then all of a sudden had this complete mindset shift and decided that she wanted to do things natural. She read these books, she had this experience, felt very empowered, she was all excited. And so she went to her doctor and was like, okay, like I'm changing plans, here's where we're going. And she's like, I'm not pushing on my back. And her doctor's like, well, like, I mean, that's totally fine, but once it comes time to deliver, I'm gonna have you move onto your back. And she's like, no, you're not. And her doctor's like, well, I mean, that's usually like, what we do or policy wise. And she goes, well, can I ask why you want me on my back when I'm actually delivering? And her doctor was like, well, to be honest, I've never delivered in any other position. And she goes, well, I guess you're about to. And I was like, oh boy, okay. And she did. She sure did. Yeah. And I mean, it was amazing. It was awesome. And then her second birth, I mean, she sat on, I mean, she did perineal massage leading into it. Her second birth, like, I mean, I think she pushed for maybe 10 minutes. I mean, it was on a bar stool. It was just, she just knew exactly what she wanted and how she wanted it to happen. But yeah, I mean, that first birth, like she had to fight for that. Like she had to really advocate for herself in that moment. And she didn't tear. She was on her side. Like she had, this optimal experience because she had the personality that she wasn't afraid to walk in there and be like, yo, like this is what I'm doing.
Yes. That good for her. That's like that's super cool. I love hearing stuff like that because as much as we in the birth, pregnancy, postpartum world can give you this research, give you this information, like it still kind of comes down to like who's willing to do what. And if you have those strong and know this information, if you have that strong desire, have a conversation beforehand with your provider, like
right.
Because there are some just ways things have been done for a long time. And we're definitely, I would say like this current generation of birth givers are like rocking that boat a little bit and realizing that people want things a different way, but it's slow, to get there. But I love that she advocated for herself. And if I just hope that, people who listen to this realize like you do have options. And unfortunately, if you maybe, your provider's not willing to do that, like, it's okay to switch. And, but ultimately we want everyone to be safe, taking that into consideration as well.
Well, and we're in a tough position. Like it's not our lane. We're not delivering babies. Like it's not,
I've only been in my own births, like, cool. You've seen others. Like, I wish I could, I would love to.
Yeah. I mean, I've seen a gamut. I've seen a gamut. I've definitely been in births
really cool.
before where every routine episiotomy, like I watched that happen just like right in front of my face.
One of those. Yes.
Yeah. So that was definitely, it's not, again, like I think that every provider has their right and the way that they do things, and I'm not discounting their abilities to do whatever they deem fit. But when we know the research, we know all of the things, and yet we're still like maybe taking things in a different direction. Yeah, I'll never forget the sound of that. That was a special sound for
Okay.
sure.
Well, yeah.
Yeah. Well, and maybe speaking to that a little bit, like why
Yeah.
have, like from the pelvic floor space, like why
Yeah.
have we gotten away from, and why are, for the most part, most providers are not doing this. I will say that, like
Yes. Yes. Yes.
overwhelmingly, it is very well known, like routine episiotomies aren't really occurring
Right.
anymore.
Right. Right.
And why?
So, you know, things are always changing. And that's why we call it a practice, right? We're always learning from what we've done, how I treated myself, like how I treated physical therapy even 12 years ago, things are changing. So, episiotomy, it's kind of like you cut the shirt and tear it, it's going to tear further than if you just let the shirt just kind of rip on its own, right? They used to think it'd make for like cleaner edges, you know, like we'd be able to stitch up easier, but episiotomies, just routinely, if not needed because of like possibly just needing, you know, brachial plexus thing going on, or forceps vacuum, the tearing can be more severe. And we do know that like if we get into third, fourth degree perineal tears, another term OASIS, which stands for obstetrical anal sphincter injuries, which is where we tear all the way to our sphincter through our rectum, you're at a much higher increased risk of like fecal incontinence, pain, just a whole slew of things that like, and that doesn't mean it's going to happen, but you're at an increased risk of some of these other symptoms happening. And so it's, you know, if we can avoid that, healing is going to be so much easier, you know, lower risk of infection, all those things. But, you know, as someone, I had a grade 3, third degree episiotomy, unfortunately, you know, but I'm doing well, you know, like,
Right. Oh yeah.
And I'm doing fine. And I know what to do with my body. And so it's not, I wish it didn't happen, you know, but here I am. And I think there's a lot of people who've had some like birth trauma, and there's people to help afterwards, you know, and definitely I'm talking mental health too, you know, but also on the physical front, and just using that team to help you recover if it does go that direction. But there's always ways, and I can run, I can jump, I can sneeze, I can poop fine, you know, like all those things without worrying. But there are people who aren't in the same situation as me, you know?
No, absolutely. I mean,
I want them to know there's help.
Yeah, I had 2 routine episiotomies just because that was part of the, granted, my olders are 16 and 14, so this was a while ago. That was kind of pretty typical, and I didn't balk at it back then. And then with my third, he was significantly larger than my first 2, but I did tear, but I tore on my scar line, which is fairly common, you know, postpartum from that perspective, so it didn't necessarily surprise me. But it's not like I did anything wrong. It's not like,
no, right.
I think some women carry around that, like, what did I do wrong? Or how did I make myself tear? Or, you know, was my baby too big for my body? Or like, just like so much of that internal guilt that we like take on because of the result of maybe some of those ramifications of birth. But like, there are things that you can do to advocate for yourself to maybe try to prevent some of that, but then there's also things that you just can never control and never be able to, like, you know, foresee. And that's what the resources that you guys are giving are for both. It's for both scenarios here. It's not just a one size fits all.
It's not, you know, and that's the cool part of the, you know, job we're in is, like I said, we're in the, like, people just want to have a healthy pregnancy, preventative, and then we're seeing people just, God, in the trenches, they're just physically not doing well. You know, like the whole spectrum of where people are at in life, and how we can support them through that whole range. You know, and that's a very rewarding part of that, of being a pelvic floor therapist. And speaking to just like a little bit of like postpartum, and you kind of mentioned earlier people are getting a little better at like the rest component after, and
Mm-hmm.
it's there's just still like this gap, that I like, that's like we are trying to get back way too fast, or we do nothing and then try to go back to our pre-pregnancy fitness routine, and I'm like, there's this whole range where I'm like, okay, for sure we need rest, at the beginning. And I do think sometimes people are trying to get up and going way too fast, but then also it's like we're waiting so long to even do anything, but you're also lifting up a car seat. You're doing these things that are requiring a lot of effort from you. So we need to be strong. So it's finding that like middle ground of allowing that rest, but also slowly building up our body to be able to take on the tasks of motherhood, because they're not easy. And you're going to be required to get up and down off the floor. You're going to be required to put a car seat in and out of a car,
and like the one-sided like positioning that we get into, and that internal shoulder rotation, and like there's just so many different things that you don't even like necessarily realize. That I've been holding my baby on my right side for the last 3 months. It's probably causing some compensation somewhere in my body.
Right. And let's hope your baby doesn't have a torticollis in the meantime, but
right.
The baby look both ways. But no, it's finding that like balance. And I know that you guys have like the postpartum program, which I think is fantastic. Whether you do something like that, that's like a little bit guided, or a pelvic floor therapist to help you, because it's going to look different for every single person. And that's why I wish I could just be like, go do this program, but this online program, but everyone is so different. As much as like the ease of that is fantastic. Everyone's birth story is different. Everyone's body's different. Everyone's recovery is different. It's just so individual. And so, but I also don't want people to be fearful of moving, but I also want people to take rest. It's just this whole, like, I wish it was simple, and it's not,
Right.
It's just, our bodies are complex, and don't be afraid to ask for help.
Yeah, I think that's the thing that we talk about consistently in that, return to, whether they do the postpartum, like, workshop, or they're doing, the return to movement once they're coming back into the gym, which are 2 different programs kind of directed at postpartum. But the referral is still always there. Like, it's always like this, and you need to be seeing somebody. Like, and, there are things that we just don't know and can't see. And, it's really important that you still see somebody that's just going to make this work that much better, and it's going to work that much easier and more effectively when you're seeing somebody that can specialize on internal and core and breath and, spinal rotation and like just so many different things. Yes. And, but also, having a movement program that's going to help on increasing awareness in the posterior chain and developing the posterior chain, lengthening the chest, strengthening the thoracic, like getting mobility in the thoracic, like, and developing progressive overloading the core slowly. There are like all of those foundations within the fitness space, but that only works to a certain level if like the foundation isn't really addressed deeper and more professionally from your guys' side.
Well, and what you mentioned, I mean, giving birth, whether it's vaginally or cesarean, like, well, for sure cesarean, major abdominal surgery, first of all, okay? But then even a vaginal birth, your pelvic floor muscles are stretching up to like over 200%. Like, it's insane. Like, and then if you do have some tearing, you just had some muscle tear, and then, you get a sprained ankle, you go see a physician. You have a,
ACL,
a shoulder, like you get to see someone to help rehab your body back because of the injury it went through, the trauma or whatever happened. And why are we not treating our bodies with the same grace? Like, I need to help support my body. I need someone to help me. I need someone to help me rehab the major physical changes that my body just went through, and so it's just always I'm like, people act like this was no big deal. And I know people have babies all the time, but like, our bodies went through a lot, and they have changed. Whether, I know people want to get back, but like, your body carried a baby, you deliver, your body is different. Your abdominal muscles have stretched, tension is different, things have changed. Like, let's have someone help you in that
And
change.
it
Just like
doesn't
we
mean
do
it
after a
can't be
surgery.
better. It doesn't mean you can't be stronger
Oh no,
because of
that's not
the
right.
opportunity that
Yes.
you're taking to actually slow down and like do things correctly. Like you might
Yes.
end up stronger than you've ever been in your life because
Right.
of the intention behind. You may not. It just depends.
Mhm.
But
Right.
like I think that you're setting yourself up for the opportunity for that to happen by being intentional and slow. And I don't know, I mean, I've read a lot of historical books on birth and all of the
Yeah.
different women's health craziness, which we could spiral down forever. But in regards to like what I think it's just generational. Like I remember after I gave birth to my first son, I like it was probably, I don't know, 2 or 3 weeks after I had had him, and my mom was in town, and I had to go to the bathroom, and I'm like, I have to go to the bathroom now. Like there is no like, right? Like in that immediate acute phase, it's like
For
there
sure.
is no like waiting. Like I gotta go. Um, and I like ran into the bathroom, went to the bathroom. I'm like, God, like that, I've never done that before. Like that was weird. And I'm also 21 at the time, so I'm like a little baby.
Yeah.
And my mom's like, well, yeah, you just had a baby. And I'm like, well, I know that. Like I'm very aware I just had a baby. She's like, yeah. And I'm like, so that's just it. This is just how this is going to be. And she's like, well, I mean, laugh it off and move on. Or like, how many times have we seen reels on Instagram of like, ha
Mhm.
ha ha, laughing, like pee my
Mhm.
pants. Like it's just like this thing that we have generationally, I think, just either A, never talked about, and B, like just accepted as normal. Like, or this is just like how it is now. And I think millennials, and I've said this before on many different occasions, but like millennials are just really loud and like not okay with
Mhm.
the treatment and like the status quo of like the way things have been. And so they're getting real loud, I think, through that. And that's what we're seeing within the pelvic floor space is we're seeing those millennials starting to like go through that and they're like, yoo-hoo, not okay with this, not gonna take it. And now, like, they're starting to approach perimenopause, and that's where this is getting loud now. Like, hello, like, not doing this either. Like, we need to change something. Like, something's not working for us over here. So, that's my theory anyway. I don't know if that's a real thing, but I just feel like, I mean, you and I are millennials, and we're sitting here having this conversation, I'm assuming. So, it's just flipping the script and like changing the narrative. I mean, I am not ashamed to like talk about like the things inside my body that make me as a woman and like the trauma that has happened in not in a negative trauma aspect, but like this is an injured state. Like I've carried, more than 3 pregnancies actually, and been my body has been through a lot of different things, and how your body responds to those and how it brings children into this universe. And C-sections is like a whole nother gamut, which we could do probably an entire podcast on C-sections alone in regards to like pelvic floor support, because of many different things, I'm sure. But yeah, I think it's just people just need to keep asking questions and keep demanding answers in a way that like feels right for them, consistently, and coming into seeing professionals like you that are going to advocate for them and teach them the right things to ask and like what to expect. And I think coming to see you at 10 weeks is just pregnant is like, I mean, something's changing if you're getting those phone calls.
People are being loud. That's,
Yeah.
and yes, thank you for um, what you said. And, I think it's what I just like, people don't always like kind of when someone's like, what's your elevator speech thing, and I'm
Mm-hmm.
always like, what? I help people pee, poop, and have sex, like
Mm-hmm.
as I do a lot more than that. But it's really like those things that people don't want to talk about, but they are essential. Like these are things that need to be comfortable and not embarrassing. And if I can just tell anyone, like I know there's no TMI, there's no, like, how much I hear that a day, like, well, this is probably TMI. I'm like, well,
Hi,
that's the stuff I want to hear. Like, tell me more. Um, but no, like sex does not have to be uncomfortable, does not have to be
Tammy.
painful. That that's not, I mean, unless you want it to be, but like, it's not a, you know, it's, if you don't want
Yes.
it to be, it does not have to be. So we're there to help you. the like, well, I only pee occasionally here and there. And it's like, okay, like that's, if you're okay with it, like, but you don't have to, like, let's work on this. And I'm not, as much as I love and think that pelvic floor therapy is so helpful, like I'm also going to help you. Like if I feel like, I don't, we've done this, like we might need to try something else. Like, and that's the part that like, I wish, sometimes I don't know like other options, and so just helping guide people through that. And surgery is not a failure, like I think sometimes people are like, oh God, I failed because I did, and it's like, it's not like they're just meeting people where they're at. Like you should be able to poop without pain, without constipation. You should be able to not be in pain, in whether that's hip pain, tailbone pain, that pelvic, if you haven't tried pelvic floor therapy, try them for some of those things like your low back pain, your hip pain, tailbone pain, hemorrhoids, constipation, like there's so many people don't realize what all pelvic floor therapy can do. It's not just the postpartum mom who pees their pants on the trampoline. Like, yes, it's that, but it's also so much more. It's endometriosis, it's interstitial cystitis, it's PCOS, it's, just system diagnoses that can affect your pelvic floor. So, it's great to have them on your team, and then collaborating with everyone else who needs to be on that team of yours, and finding that group of people who really just help support you in your body and get you living, the way you want to be living.
Yeah, absolutely. I mean, it's gotta be a collaboration effect. And I think it's hard to prioritize your self-care in that way.
It is.
Like, I think that if we're going to invest in hair, nails, skin, like all of these other things, like all of that matters. Believe me, I'm sure, like I'm game for all of that. But at the same time, like, advocating for yourself now or as soon as you decide to in this space, it's never too late, like we said, but like advocating for that, like we're talking about the rest of your life, that this could like be not only a treatment that makes you feel better now and carries forward, but it gives you tools to help with the rest of your life. Because as a woman, as we know, like things shift, like you mentioned, like perimenopause, menopause, all those things. Like, let's hope that there's a generation of women headed into perimenopause and menopause that have had physical therapy already in a way that we can help support that transition and be aware of the things that we need to be doing to help support that transition and make it easier, because it's not just postpartum, like you said. It's a whole range of support here.
I mean, I think one of the leading causes of people going into nursing homes is incontinence, like, or risk of falls because they're trying to get up to go to the bathroom all the time. Like it's, let's get on top of some of this. Let's like keep people at home. And there's other reasons too, obviously, but that's something that can hopefully be controlled earlier, and let's, get ahead of it.
Yeah. I remember caring for my ailing grandmother and just the nurse just pushing things back up there. And when she went to the bathroom, like it was just like
those organs in our body, if we can.
Yeah. UTIs and like all of those different things, like just doing these things now in a way intentionally, as soon as you know, as soon as you're aware, investing in yourself in that way is going to pay off so much more from your quality of life perspective long term. And like what you guys are doing is just so important. I know you guys are a cash-based model, right?
Yeah. So cash-based, I usually say we're out of network. You can use your insurance benefits, but instead of being in network, we've decided to be out of network, so that we're making our contract with the patient and not the insurance company. But that's just kind of what we've decided to do. It's how we feel like we can practice how we want to without maybe some stipulations from insurance. But regardless, if you ever aren't sure to reach out to, if someone's listening to this, call us and you need to use your in-network benefits. The good news is the pelvic health field is growing exponentially, and so there are other therapists in town and surrounding towns that we would help guide you to. But and
I think that people need to understand that there are benefits of going with somebody out of network and not utilizing your insurance. Like there are very big benefits in regards to the type of care that you can gain from that, the flexibility that you have in the way that you can treat, the time that you spend with your patients. Like there's a lot that you gain from, utilizing and investing in yourself in that way. Yes, like postpartum, I get it. Like if you reached your deductible, like you want to be able to like use your benefits. Like I get it, but like there is a benefit to it in this regard. Like not only, you and Steph being like a huge wealth of knowledge and incredible practitioners in and of yourselves, but the flexibility that this also gives you is very empowering, and very, imagine that. It's, right. But also just like very beneficial to the women that you serve.
It's, insurance can be fantastic. Like, I'm not saying it can't be. It also, with insurance comes a lot of regulations. I mean, I think yesterday I did a new evaluation, and she had a major abdominal surgery. I was working on her with like some scar work, core, returning like some core strength. And she was just kept talking to me, just like her upper back and neck tension. She's like, oh my God, just like, I'm tense all the time. I'm like, well, let's do some work on that today. She's like, you can do that? And I'm like, yeah, I mean, and I'm like, because I'm not restrained by like this one order that says only then you get into certain models where it's like, well, I'm going to need a doctor's referral for this, so the insurance will cover that. And it's like, it just makes it challenging. It just allows us to treat. We're not, changing the treatment time based on the insurance company that you have, because they only pay so much. And we can treat wherever we want in the body.
You can take a more holistic approach.
Like we're trained, and we know that if we see something that needs to be seen by a doctor, we'll refer appropriately. But it just allows us to have that time to be able to look at your body and not like, you come in with a headache that day, let's work on your headache. Like, and sometimes that doesn't always work in a more traditional model. Because that's not what you're there for, but I would argue it's all connected. So
it's all connected, right?
I can justify why I'm working on this, but it is, it's transparent. You know what the price is going to be, not sure what's going to come back. So for us, it has worked. It has allowed me to just practice so wonderfully. I'm not fighting with insurance about getting treatment covered because I know it's necessary, but they don't think that this is necessary for their life, even though it is. But, so it is, it's beneficial, but understand that, it's not always going to work for everyone. So, but there's there's always someone we can help you find.
Right. Absolutely. And you don't have the limitations of how often you can see them, or, like any of those things.
Visits.
Yes. You have like the ability to have this holistic, bigger picture approach. Is it,
preventative with like 10-week pregnant. She's coming in without symptoms. Like, what do you put as your code to, I could make I'm sure someone makes something up, which is, but that's, insurance doesn't pay for that, No. And so it's just it opens the doors to like, just being able to treat that, like that whole spectrum. Like, I just want to feel good. I want to prevent to, I am in a lot of pain and I'm just not getting the care I want,
Yeah. And I think it's important to touch on that, because I think that that's something that, especially in the Midwest, that people definitely like fight back on a little bit too, I think. But the benefits of it, and, with in the hands of the right providers like yourselves, it's an incredible treatment opportunity. Does it require more of an investment? Yes. But it's just a different mindset to take on it. Like there's a different opportunity here to kind of see, in regards to the treatment that you might receive. I'm not saying that people that take insurance don't treat well. Right, it's just at times they might be a little bit more handcuffed than others.
Exactly.
And that's okay. That's not a bad thing either. It's just a different approach. So
different models, and works for different people. And so,
awesome. Well, how can people find you? What's the easiest way for people to get a hold of you, schedule with you, ask you questions? What do you got for us?
Call us. I don't know how all the podcast stuff works, but I think.
No, I'll get all your information. Yep.
Go to our website. We have a contact form where we will, can reach back out via email or phone call. You can email us. Our email's on there as well. We're on Instagram at empowerpt_LNK. We can talk there, but
Okay.
honestly, email, website, phone call.
Okay. Do you do anything virtually at all, like consults or anything, or is it?
We
Okay.
are not doing that. But I am known to, like, talk to you over the phone for a while if I have a few minutes. So
No, that's good to know. Just from a,
if you have some questions, I definitely will be like, oh, well, what's going on? So if I have the time in my day, I'm happy to just see if even you're appropriate, or if you have questions, a little nervous about the situation, if that like internal assessment scares you, I'm happy to talk people through that. It doesn't have to be done, but sometimes people just want a little more clarification of what a visit might look like. And we're always happy to have that conversation. We just want people to feel comfortable. That's what we love about Empower Physical Therapy, is that our clinic is a pelvic floor physical therapy clinic. Like, we're not pelvic floor therapists in a orthopedic building. This is all we treat here. It's what I treat in, day out. All of our therapists are specially trained in pelvic floor therapy. And so it's maybe a different vibe, a different feel coming in here maybe than some of your other clinics. I don't know. haven't been to all of them, so I can't speak to them. But we want people to feel comfortable, feel heard, listened to, and that's what we hope people can experience if they come here.
Male or female,
male or female, yes.
Yeah, it is common in males too. So it's not something.
Yes.
If you need to go home and ask your husband about his issues, you can do that now.
those are our male clients a lot of times. Like, the wife is in here and like, oh, can you maybe help my husband with this? It's like,
sure can. I'll just bring him in next time.
Yeah, let's do some back-to-back treatments.
No, it is, and we laugh about it, but it really is like it's across the board. It's a human muscle. It's something that is part of all humans.
And it's hard as much how far we've come with women talking about it. It's even harder for men, So
yes.
When they come here and they're open to talking, that they've been through a lot, and I'm happy to be a resource for them, because not all pelvic floor therapists are comfortable treating men or do treat men. So we all treat men here. I have a son, and I think that was my driver in it. It was like, if he ever had something going on with him, I hope he wouldn't have a hard time finding someone who would take care of him. So
yeah, I think I don't think he would care that. My dad started with a hemorrhoid removal surgery, and then it just like spiraled from there, and low back pain, and he was like taking a pillow with him anytime he ate at a restaurant or like had to sit on something, like it just like spiraled. No, and I'm like, this doesn't seem like a just like go to your normal PT situation anymore. This seems like it should probably be a little lower than that. And so he finally believed me, and he's embraced that.
Good for you.
But I wouldn't have known. I wouldn't have known if I didn't know like the women's side of it, like to correlate that, right? So, well, I appreciate everything that you are doing for women within Lincoln, obviously, and being on here to help, talk to women across the gamut. I think continuing to normalize the conversation around all of this stuff is extremely important. There are a lot of symptoms that all of us suffer through as being very common, not normal. And that is what you guys are here to help support and change the narrative there. So thank you for everything you're doing.
Thank you.
And we'll continue to do, I'm sure. And I know you're a busy lady, but you are taking new patients, right?
We are, yes.
Okay. Awesome. Well, we will get your information, get it in the show notes. And thank you again for your time today, Jami.
Thank you so much.